Good afternoon. Welcome to the University of Michigan School of Public Health Graduate Information Session. My name is Kristen McCarthy, and I'm the Graduate Residential Admissions Coordinator here at the School of Public Health. Today's session will be primarily geared towards Masters of Public Health and Masters of Health Service Administration prospective students. The webinar will include information about our 6 departments, including our online program and the application process. At the end, 2 current student admissions ambassadors will be joining us. What is public health? Public health is defined as the science and art of preventing disease, prolonging life, and promoting physical health and efficiency through organized community efforts. Public health is all around us. It's the quality of the air we breathe. It's the flu shot you get at the pharmacy. It's the ethics of genetic testing. It's the creation of policies that govern healthcare. If you hear about something in the news, it's likely that there is a public health angle to it. So here's the common denominator. Everything we do in public health is about improving the health of people at a population level. Michigan School of Public Health is pursuing a healthier, more equitable world through education, research, and action. Included on this slide are the 6 graduate academic departments where students can focus their degrees. In addition, the Masters of Health Informatics, a joint degree with the School of Information, is listed as well. There is no specific undergraduate degree or set of professional work experience required. However, some departments have recommended and required courses they're looking for. There are endless career opportunities within the field of public health, and you are bound to find your niche. In 2018, the top 4 employment sectors were hospital and healthcare providers, academia, consulting, and the private industry. Here are some numbers about our school. There are 1,300 current public health students. This includes our graduate residential and online students, as well as our undergraduate students. We have around 170 faculty members. If you are interested in research, we currently have 34 research centers. As a graduate of the University of Michigan, you become part of the world's largest alumni network. As noted, our faculty to student ratio is 9:1. I think a lot of the time when people think of the University of Michigan, they think about a large university where they are just a number. But we strive to support students from all angles. As a public health student, you will have access to support services at the university, school, and department level. All of our students are also assigned a faculty advisor. The Masters of Public Health is our flagship degree. We offer a residential program in Ann Arbor that is 2 years long and takes 60 credits. We also offer a fully online program that is a 20-month-long program and 42 credits. Additionally, we have a Masters of Health Service Administration available in our Health Management and Policy department. If your interests are more research-based, a Master's of Science or PhD are also available. Those programs are administered through departments as well as the Rackham Graduate School. Our university is made up of 19 schools and colleges. As a public health student, you can take courses at any of those schools. With 97 graduate programs ranked top 10 in the country, you have the ability to learn from leaders in other fields. The school has 7 formalized dual degree programs. Students interested in applying to a dual degree program should apply to both schools separately as normal applicants. If admitted to both, then you complete 2 master's degrees in 3 years. The MPH and MHSA application are administered through SOFIS, which is the common application for schools of public health. All supplemental application materials need to be sent directly to SOFIS. There are 2 required essays. The first is your SOFIS statement of purpose. It's a 1,500-word essay that addresses questions such as why Michigan Public Health, and that talks about your future goals and aspirations. This is where faculty are able to hear your voice and your passion come through. The second is a reflective essay. This is a 500-word essay that helps share what characteristics or experiences you have that you can contribute to our community. You can also speak to areas of concern with regard to the application, whether that's a lower GPA, test scores, what have you. This is your opportunity to address those things. The next piece is your resume. Here, I encourage you to highlight your academic accomplishments, relevant coursework, awards, research, things like that. Your resume is not a required component of the application, but it is highly recommended. Also, we ask for 3 letters of recommendation, ideally 2 academic and 1 professional. We require 3 letters of recommendation as part of a completed application. And while SOFIS will allow you to submit more than that, please remember that quality is better than quantity. Academic letters of reference should come from a professor who can speak to your academic capabilities Professional references should come from somebody in a leadership position who can speak to your work experience. Lastly, test scores. A standardized test is a required component of every application for each of our departments right now. All of our departments will accept the GRE. All the departments accept the MCAT score, with the exception of our biostatistics and our health management and policy department. We do not have a minimum score requirement. We participate in a holistic review process, so no one piece of your application will make or break your opportunities. We encourage you to incorporate all of the extracurricular activities you've been involved in. These can include things such as research, professional, service, and volunteer experiences. All of the application components listed here are taken into consideration. There is not one thing that's going to make or break your application. Faculty reviewers are looking at the total package. As a school, we practice that holistic review process when making graduate student admission decisions. Holistic review ensures that no single factor leads to either accepting or excluding a student from admission. Currently, we are accepting applications for the residential program for fall of 2020. The online program application will open November 1st. We have various deadlines, so I encourage you to review this slide as well as our website. For our residential graduate programs, the application opens September 1st, and they have a priority deadline of December 1st. For some applicants, there is a hard deadline of January 15th. That deadline applies to students applying to the Health Management and Policy program, as well as our international applicants. International applicants and Health Management and Policy applicants must have all materials submitted no later than January 15th. All other departments and applicants are reviewed on a rolling basis after December 1st. Departments will close at various times when they feel they are at capacity. Please note our website will have updates as to whether the department is open or closed. Our online graduate application is opening November 1st, and they will have a priority deadline of February 15th, as well as a hard deadline of May 1st. As mentioned, our MS and PhD programs are administered through Rackham Graduate School, so you'll want to visit their webpage for more information about the application. We recognize that cost plays a large role in your decision-making process. We encourage all students to complete the FAFSA form. Your SOFAS application serves as your application for Dean scholarships. There is no separate application needed. Once admitted, you will be evaluated for our Dean scholarship. Communication regarding scholarships typically comes after your admit decision. About 35% of our students will receive an award. This last slide includes key staff members who are available to assist you throughout the application process. Please do not hesitate to reach out if you have any questions. It's truly a team effort when it comes to the application process, and we are happy to help you along the way. At this time, we will turn the camera back on and have our two current student admissions ambassadors join us. I am joined today by Haley Tomlinson and Jasdeep Kler. If you guys wouldn't mind starting by sharing a little bit about yourselves, that would be wonderful.
Yeah, so my name is Haley Tomlinson. I'm a second-year Master's in Health Services Administration candidate with our Health Management and Policy program. I'm a native of Michigan, and I came here, my undergrad was done at Central Michigan University. I had a pre-med background. I also worked for 4 years before returning to graduate school.
Excellent.
My name is Jasdeep. I'm a second-year Global Health Epidemiology student, earning my degree in Master's of Public Health. I'm originally from Wisconsin, went to the University of Wisconsin for undergrad. Similarly, I had a science background, but yeah, love Michigan.
Excellent, great. Well, like I said, definitely feel free to share your questions in that chat box. While you guys at home are still thinking of your questions, can you guys share with me what helped you decide to choose Michigan Public Health?
Yeah, so for me it was definitely, and Kristen mentioned this earlier, our alumni network here is great. That's especially true, or at least it's highly promoted with the Health Management and Policy program, but is undisputedly true for all of our programs. And it's great being able to go literally anywhere and find somebody that recognizes the Block M and is willing to make a connection with you over that. I have heard so many stories of people in my cohort where they'll be at conferences in like other states, or I did an internship this summer in Washington, and one of the senior leaders there was from Michigan, and so immediately like sets up a meeting and offers to help, connect you with whoever you're interested in talking to. So just being able to go pretty much anywhere and have that instant connection with other industry professionals is really great.
And for me, it honestly came down to like financial resources. So graduate school is expensive, and it's expensive for a lot of people. And the University of Michigan has a lot of financial resources. So like you mentioned, the Dean Scholarship and getting those like automatically being put into that pool just by applying was great. So there was no extra like application or anything. And on top of that, if you're interested in doing like a service fellowship, which I'm doing, or if you're interested in doing like an international internship, there's plenty of opportunities for that as well. So it's like, long term, you're going to be able to minimize your costs when you go to the University of Michigan or somewhere else.
Excellent. So that kind of leads into the first question we have here. Is there any support provided for securing those summer internships? Each of our programs requires a summer internship. Did you guys, as second years, feel like you found support in finding those?
Yeah. So I'm in the Global Health Epidemiology program. So one of the requirements for that program is you have to do an international internship. So like pretty much as soon as you get here, you're starting to like figure out what do you want to do, where you want to go. And a lot of people have like topical interests before they came here. They have like area interests. I have classmates that were interested in India, so they went back to India to do any project in India. Or I had like friends who were specifically interested in like gender health. So they went wherever gender health was like an option. And the University of Michigan itself has a lot of resources. There's different like global health departments within like the school as well as within the university. So you can like connect through faculty, which is what I did for my summer internship. I was in Thailand and Indonesia doing like cancer research. But otherwise, like if you don't want to go through faculty, I know people who go through nonprofits. There's like plenty of avenues and there's a lot of support here for that.
Excellent.
I can give a very targeted perspective in terms of my own department. So for health management and policy, kind of the opposite. A lot of us come in having no idea what we want to do for our internship. And our department and the school is extremely supportive in that. So we actually have an internship coordinator for our department, and she collects the list of, I won't even try to ballpark, but well over 100 organizations that reach out to her that she has connections with that want us as interns, because as was mentioned, we are a very well-reputed school, which is a great perk of being at Michigan. And so you have that list to work off of as a starting point, and most of us do get internships in various industries offered through that list, but you're also welcome to look anywhere else, and the department will support you in that and help find a connection at a specific organization if there's someplace you're really interested in going.
Excellent. Very cool. So outside of the classroom, we do have several different student organizations available, as well as the wider campus offerings. Can you share a little bit about what student orgs you guys are involved in?
Yeah, so I'm a chair for our corporate relations committee for the Michigan Healthcare Executive Student Association. And then I'm also on the executive board for the Institute for Healthcare Improvement. So the health management and policy department specifically has a lot of student orgs that are really targeted around like management and policy. And I think all of the other departments have something very similar. And then I'm also involved with professional organizations outside of school as well. But just as like a shameless plug, I think, there's, I think over 1,600 student orgs, I think is the number at the University of Michigan. Right. So there's something for literally everything you're interested in.
Yeah. So I'm a treasurer on the epidemiology student organization. So we're like the representatives for all epidemiology students between like faculty, staff, and like the rest of the students, which is like nice to be an advocate. And then I'm also a part of FAST, which is the Public Health Action Support Team. And that's one of the main ways I found that you can actually get like practice opportunities. So with FAST, I helped do like an evaluation for a children's literacy network and like a nonprofit. I went to the Virgin Islands to help the CDC with like a needs assessment. And through FAST, as well as, this isn't really like an organization on campus, but it's available to students here, the Albert Schweitzer Fellowship, which I'm a current Schweitzer Fellow, and I'm doing a service project to teach mindfulness to youth in incarcerated settings. But this is like an opportunity that's open to all students, and it's like you have a specific interest, you want a specific project, you have specific strengths, you actually want to go from like classroom to practice, there are plenty of opportunities to do that. So yeah, those have been my main involvement.
Excellent. Yeah. So we do have another question here about support available for finding job placements once you've graduated. Do you feel like there are support networks available to you?
Yeah, so again, I can speak largely to my department, although the School of Public Health has a careers department that is absolutely fabulous. And they will help you with everything from your resume to your cover letter to actual job searches. And I can't like plug them enough. I have, oh my gosh, Crystal is amazing.
They even have like dinner
Oh yeah,
etiquette?
they do a dinner etiquette where you go and actually have dinner and learn about like which way you're supposed to pass things around the table and the fact that you're only supposed to butter one bite of your roll at a time. So it's really fun. But they do very much support. They have a ton of job opportunities that they post school-wide that are open for all students that are interested to apply to. And we have a lot of recruiters from different organizations come for either informational sessions for both full-time employment or fellowships, as well as for like consulting organizations. They do on-site interviews even here sometimes, and we'll hire at the end of the day. So definitely a very supportive environment for a job search.
Yeah, so the career development office within the public school public health is great. They help you with resumes, cover letters, headshots, whatever you really need. And even with like outside of the school of public health specifically, I don't know what their official name is, but there's like a career office for the entire university. And they I've gone to them because right now I'm applying to medical schools. So they're able to like provide like targeted medical school interview advice and targeted like medical school like personal statement advice. Which is like just as like a broader general thing that's really good with the University of Michigan is like if you're interested in law, you can go to like the law school and get resources there. If you're interested in medicine, you can go talk to someone in medicine. If you're interested in whatever field you are, there's plenty of resources around campus, maybe not specifically in the School of Public Health, that you still have access to as a student.
Excellent. So I do notice that we had a couple of pretty specific questions. Definitely feel free to share those with our sph.inquiries email box so that I can address those for you directly. Can you guys share with us a little bit how heavy you feel like the course load is? Somebody's asking specifically for the MHSA, but I think we can talk about the health management and policy as well as the epidemiology course load.
Yeah, so I'll be honest and say that for me, I think it was a little heavier than I anticipated coming back to school. That being said, I also worked for 4 years, and so coming back and having to write essays and do homework assignments is very different from being in the working world. And so it took me longer than I think some of my classmates to adjust to like having to plan that time. I don't think the coursework is unreasonable. I'm a full-time student as an MHSA candidate. I have 2 part-time jobs. I'm involved in 2 student organizations as well as professional organizations in Detroit outside of school, and I still have time for social life. So I'm not going to tell you that it's like light because I think that would be false, but it's most certainly manageable, 100%. And like I said, plenty of time left in your schedule to do other things as well.
Anything to add?
Yeah, I guess within epidemiology, it really depends on like your background, because I feel like there are some people who like biostats isn't something that they'd ever done, ever considered.
Sure.
So it's like that biostats class, the first semester is going to be challenging. Or if it's like we're learning coding, SAS coding, and it's like you've never coded, you never thought about coding, and it's like challenging for you. So it really does fluctuate depending on like the individual. But like regardless, there are office hours, there are resources that way. Even if you are struggling with biostats, you can go to office hours for biostats and get the grade that you want to get, still learn the material. But it can be a time commitment depending on your experience.
And we also do a great job, not just like school resources, but at least in my department, and I'm sure this is true for other departments as well, of like support within your cohort. So like for classes that have a lot of reading, we might make like reading groups. So everybody does a portion of the reading and takes notes and then shares that with everyone to kind of help control your homework load as well. So.
Thanks. Do you feel like overall there's a pretty collaborative feel to your cohort?
Oh yeah, 100%.
Okay.
And that's something in every single, and I don't know if this is as true for you, but at least for the health management and policy program, I would say that well over half, probably like 70 to 80% of your assignments are going to be group work. So they very much reinforce working on teams here. And we do have, everybody in our cohort of 65-ish people has great relationships. We all do social events together as well. So very collaborative.
Yeah. Within like epidemiology and global health, epidemiology specifically, it kind of turns out where it's like whatever your topical interest is, that's where you like find your group sort of. So it's not really that like everyone in the global health cohort are specifically like always doing stuff together. Like epidemiology is always doing stuff together, but it's like people who are interested in maternal and child health within these different like departments, within nutrition, within epidemiology, within health, behavioral health education, within HMP, are all like interested in the same topic. And that's kind of like your social network. But I'm guessing that like varies depending on like what you're more passionate about, what you're more interested in. So yeah.
Sure. Another question for you guys. What would you say is a piece of advice that you wish you had had when you were applying?
You can go first on that one.
So talk back to your previous self and give them some advice.
Yeah.
Oh.
Yeah, just like really look into the different schools that you're applying to and the different programs that you're applying to. If you're interested in like specific certificate programs and things like that, like look into those and talk to students who are doing that. Because one of the mistakes I made was like, I knew I wanted to do public health. I wasn't sure exactly what department I wanted to fit in.
Mm-hmm.
So I just like picked two departments that I thought were like similar enough. I did HPHE and I did epidemiology. When it came for admitted students, it was like kind of when I decided, but it would have been nice to like have thought of that before, consider that before. Look at the different certificate programs that were available and be like, it might be unreasonable for me to do like the global health epi track, which is very structured. You have like classes that you have to take as well as trying to do a certificate outside of the school of public health, right? So it's like, there's things that are possible and how realistic they are. You don't really know until you like reach out to a student, talk to a student, like actually do the research for that. So just like invest some time into considering like where you're applying and where you really want to go.
Okay, I have two.
Okay.
So one would be for application specific. I would say be yourself when you're working through your application. People want to know who you are. They want you to be authentic. They want to hear about your passion for what you're doing and what. There's no model of what people are looking for. There's no like stereotype of what's going to get you in versus not. So be yourself. And I would also say just like don't stress as much. That's what I want to tell myself. I tell myself not to stress so much. It's all going to work out. Wherever you end up, it's going to be great. We hope it's here. But everything's going to be great. And like make sure you take the time for yourself as well. Application season can get crazy and like you get stuck in your head and there's so much pressure, but self-care is important and it's all going to be fine. That's what I want to tell myself.
All going to be great. Well, thank you so much for joining us, Jasdeep and Haley. And thank you to those of you at home for joining us, for tuning in, for learning a little bit more about Michigan Public Health today. We appreciate your time.